Understanding Medicare can be confusing. It's got all these parts, like some kind of alphabet soup. But don't worry, we're here to break down one important piece. Medicare Part D. Think of Part D as your prescription drug coverage. It helps pay for those expensive medications you might need. Without it, you could be facing some seriously hefty bills at the pharmacy. Now, Part D isn't free. You pay a monthly premium for it, just like you do for other parts of Medicare. The cost can vary depending on your plan and where you live, but trust me, having some coverage is way better than having none at all. Nobody wants to choose between their medication and paying rent. So, how does Medicare Part D actually work? Well, you sign up for a plan from a private insurance company. These plans are like the ones you might get through work, but for seniors. Each plan has a list of covered drugs, called a formulary. Think of it as a menu of medications. Your plan will cover some drugs completely, some partially, and some not at all. You'll usually have to pay a copay for your medications, which is a fixed amount. Or you might have a coinsurance, which is a percentage of the drug's cost. Either way, it's a lot cheaper than paying the full price out of your own pocket. Now, here's where it gets a little tricky. Medicare Part D has something called the donut hole. It's basically a coverage gap where you have to pay more for your drugs. But don't worry, the Inflation Reduction Act is here to help. Remember that Inflation Reduction Act I mentioned earlier? Well, it's kind of a big deal for Medicare Part D. This law, passed in 2022, brings some major changes to your 2025 prescription drug coverage. One of the biggest wins is that it caps out-of-pocket costs for Part D drugs at $2,000, which means that you'll never have to pay more than that amount out of pocket each year for your medications. This is a game changer, especially for folks who rely on expensive drugs. But wait, there's more. The Inflation Reduction Act also gradually closes the dreaded donut hole. So, in 2025, you'll only have to pay a small copay for your medications, even if you're in the coverage gap. And here's the cherry on top. The law allows Medicare to negotiate prices for certain high-cost drugs. That means lower drug prices for everyone. Winners of the Medicare Part D makeover. So, who benefits the most from these changes? Well, pretty much anyone on Medicare Part D will see some savings. But the real winners are seniors with chronic conditions who rely on multiple medications. These folks often face the highest drug costs, and the Inflation Reduction Act provides them with much-needed financial relief. People with diabetes, for example, will see lower prices for insulin, and those with conditions like cancer or rheumatoid arthritis will have their out-of-pocket costs capped, saving them thousands of dollars each year. The Inflation Reduction Act is a huge win for seniors, plain and simple. It's about time someone fought for affordable medications for those who need them the most. How do you navigate Medicare Part D in 2025? With all these new changes happening, you might be wondering just how to do that. Don't worry, it's not as complicated as it sounds. Upon receiving your 2025 Enrollment Notification of Change letter, called ENOC, review your current plan to see if it still meets your needs. With these new changes, you might find a better deal elsewhere. Medicare has different open enrollment periods. For Medicare Part D, it typically runs from October 15th to December 7th each year. During this time, you can switch plans, enroll for the first time, or make changes to your existing coverage. It's also a good idea to talk to your doctor about your medications and see if there are any lower-cost alternatives available. They can help you understand your options and make sure you're getting the most out of your Medicare Part D benefits. The future of prescription drug coverage. The Inflation Reduction Act is a major step towards making prescription drugs more affordable for seniors. But the fight isn't over yet. There's still work to be done to address the high cost of medications in the United States. We need to continue to hold drug companies accountable and find ways to lower prices for everyone, not just those on Medicare. The future of prescription drug coverage depends on our continued advocacy and willingness to fight for what's right and make sure that everyone has access to the medications that they need. If the information in this video was valuable to you, please give it a thumbs up, share it with a friend, and subscribe for more great content.